Welcome to CIHT Podcasts.
I'm delighted to be further exploring the issues of improving transport for people with disabilities. My guest today is Ann Frye, an international specialist on the mobility needs of people with disabilities and older people. Ann works as an expert advisor on both international and UK projects on accessibility. Can we start by exploring a brief history of accessible transport in the UK? Can you share the story of how we got to where we are?
It really started in the 1980s. The 1981 was the International Year of Disabled People, and at that time Department for Transport, along with every other government department, was thinking, we should do something about this, but we don't really know what to do. So the starting point was trying to bring together the people who design and run transport with disabled people to talk about, if we have to do something first, where do we start? Because there was nothing. So we did that. We got together a whole lot of transport operators, designers, manufacturers and disabled people, and really said, tell us where we can start. And at that time, the transport industries were very nervous of disability. They thought it was far too expensive and difficult. Disabled people said, OK, well, let's start with taxis because they're door to door. We need the buses, we need everything else. But at the moment, getting out of the house is difficult. And because the London taxi, although it has a very high floor, it also has a flat floor, it wasn't impossible then to work with the manufacturers to start to design a new type of taxi that would be accessible. So that's gone ahead, and you now see all 19,000 or whatever it is now taxis in London are wheelchair accessible. And then the same sort of process started with the buses. Over in Germany and the Netherlands, they'd had this brand new concept of low floor buses with a suspension that dropped down. Lots of people in the UK said, it might work there, but it won't work here. They'll get stuck on the hills. So we being Department for Transport at that time where I was, we borrowed a bus from the Netherlands and lent it to a number of operators in the UK and said, well, just try it out and tell us what you think. And what they found was that everybody got on and off more easily. It spent less time sitting at bus stops while people heaved their shopping or their walking sticks on board. And a lot of the concerns were just dissipated. So it wasn't too many years before you couldn't buy a bus unless it was low floor. So there was a sort of rolling momentum there. Similarly, really, with trains, which were a bigger problem because their access from the track is quite high. The doorways were too narrow. The aisles through the trains were too narrow. But just gradually chipping away at, can we modify the seats just inside the door and next to the toilet so it's wider? What can we do to get people up from the platform and into the train? And actually, unlike the rest of Europe, which has very low platforms, UK and Ireland have much higher platforms, so you can do it with a simple ramp, whereas most of Europe has to have a complicated, either a mini-part ramp like a helter-skelter or a lift. So again, technically it was easier to do it here. We haven't finished yet with trains. The end of this year is the deadline by which all trains in service need to meet accessibility requirements. Remains to be seen if we actually quite do it because of all the delays and problems that have been with new rolling stock. But it is absolutely on a roll. The legislation's in place, and that's the way it's been going.
It's interesting you mentioned the Netherlands because the Dutch city of Breda won the 2019 Access City Award, and that was organised by the European Commission together with the European Disability Forum. And the headline to the story read, "People aren't disabled, their city is." And I love that way of thinking. And you have worked across Europe on accessibility issues. How does the UK compare more generally to other European countries?
Yeah, in fact, I'm one of the judges on the Euro Access Awards, so I was involved in the application from Breda. And you're right, it's inspirational that they've turned the thinking upside down. But comparing UK with Europe, on the whole, we're doing very well. I mean, there's still plenty of gaps, plenty of things that go wrong. I would say the best country in Europe overall is Spain. And the reason for that is that way back, in what would now seem totally inappropriate, the only people in Spain allowed to sell lottery tickets were blind people through an organisation called ONCE, which through the revenue from lottery has now become a massively powerful organisation in Spain, representing all disabilities and funding a huge number of projects and leaning on government to do a lot. So universally across Spain, I would say that access is better than it is anywhere else. Just one example I particularly like in Barcelona, where the ticket machines in the metro used to be so complicated they had to employ people to stand next to them to explain, where do you put your card, where does all this. And then they came up with the idea of asking blind people to redesign the ticket machine. And now it's intuitive. No need for anyone to stand next to it. It's quite obvious what you have to do. So that sort of lateral thinking of, always before, and I suspect still in many countries, it's the engineers who design the ticket machines. Let's ask the users, and particularly those users who can't see. So it's that kind of thinking, which is not unlike what you mentioned from Breda, that really makes a difference.
And through work with the International Transport Forum and the United Nations, you advise them on the mobility implications of a global ageing population. So what are the implications of this?
It's twofold, really. One is, as we all know, the numbers of older people in the population is growing hugely. And there's a very high correlation between age and disability. So 2/3 of people with disabilities are going to be over retirement age. But also they have time on their hands, many of them. They have disposable income in many cases. And they will only go to places where they feel comfortable that transport and accommodation will meet their needs. So there's a huge potential tourist revenue among older people if you capture it. So that's, if you like, the positive business opportunity. On the other side of it, I think, is the worry that technology is moving too fast for many older people. So, for example, in this country now, it's more and more difficult to buy a train ticket unless you buy it online or you buy it from a machine at the station. An awful lot of older people still are not comfortable buying things online. They don't feel that their money is safe, and they can't operate touchscreen machines at stations. So increasingly, for all the advances in making the trains accessible, we're now beginning to exclude people by the reliance on technology. And I think it's a mistake to think, it's just a generational thing. The next generation will be really tech savvy. Because actually for all of us, technology will move faster than we do at a certain point. So I suspect everybody will get left behind by technology. So I think always we need to design into our systems the means for people who cannot cope with technology to do it by another means. Otherwise, people are going to become housebound with all the social and economic and health impacts that has.
And just on the technology aspect, you led the work of the Transportation Committee of GATES, the Global Alliance on Accessible Technologies and Environments. So going forward, say in a few years, how do we ensure that technology doesn't leave people behind? Is it about giving sort of a full range of options, or is it in that user testing? What did that find, that work?
That work was mainly looking in low-income countries across the world where our sort of first world problems about ticket machines don't really apply. But I think the future for older people is always going to be that you need alternatives. If you put all your technology into one way of dealing with things, there's always going to be people that get left behind. So it's a diversity of it, and actually putting more effort into designing technology that is user-friendly. There's a concept very common now called universal design, which is all about whether it's a building or a transport system or a computer system that is intuitive to use, that is simple and allows you to remain calm while you're doing it. So if you apply the concept of universal design to some of the computer interfaces, I think there's much more chance of developing systems that older people will feel comfortable using.
And CIHT has been pushing to improve transport for people with disabilities. And one element CIHT are exploring is around dementia and transport. So you're a fellow of CIHT, and if you were advising CIHT on how to ensure transport is more supportive of people with dementia, what advice would you give? I
think it breaks down really in perhaps to two categories. One is training. driver training is absolutely huge in enabling people with dementia to go on travelling with confidence. Because if a driver recognises that somebody's having difficulty producing the right money or finding the right stop, they're going to be much more sympathetic if they've had that training. The other thing I think does come down to design and technology. We know much more now about the kind of things that are frightening and distressing for people with dementia. So, for example, if you look at the streets and pavements, dark shadows, poor street lighting, uneven paving, an area of darkness can look like water. So people will freeze, they won't have the confidence to go on. So, good lighting, good colour contrast, clear use of colours, all of these things can actually make an enormous difference to people with dementia, combined with that training, which is fundamental.
You've advised EasyJet on training for cabin crew staff about awareness of dementia?
Yes, for some years I was involved in delivering training for EasyJet, both for cabin crew and for their call centres. And for cabin crew, you hear enormous number of stories of finding people with dementia, not always diagnosed, but the pressure in the cabin at 30,000 feet, obviously for all airlines, can affect people with dementia, and they become quite distressed and anxious. There was a story of one lady who went to the onboard toilet, thought she was in her shower room at home, nothing was in the right place, so she got angry and upset and distressed. And, cabin crew have all had training as dementia friends, and they knew how to identify that, how to help her keep calm. Sometimes it's a matter of one of the crew actually sitting down with somebody who thinks that there may be her son, and just letting her chat away to keep her calm, which is, pretty demanding for busy airline crew. But they are finding more and more that people with dementia are appearing on flights, very often travelling alone, and they need to understand, how best to help them to keep calm. And then they have to make sure, of course, that they're met at the far end, because there have been some very sad tales in airports around Europe of people with dementia getting off flights without anybody keeping a check on them and wandering off and getting on other flights and really just not knowing what's going on. So there are very clear guidelines in the aviation industry about never leaving somebody alone who has dementia, in case, in an environment like an airport, which is hugely confusing. You do need to be very alert in order to keep people safe.
Have you done anything with epilepsy or not? Does that come up much?
Certainly training for airline crews, we deal with epilepsy, yes, because they need to know, when is somebody having a seizure, and how best to treat it. And as you probably know, a lot of people with epilepsy really don't want to be carted off to hospital within a couple of minutes because it's something they're used to going through. But obviously, where your first interest is the safety of the person, you need to be trained in what to look for. When does it become clear that this does need medical assistance? And also when it's appropriate to say, I'm sorry, you can't fly. And there have been instances with various airlines of people who've had what to them is a mild and routine seizure, who've then been told that they're not fit to fly, which of course can be quite distressing and annoying. So it's a condition that I think is very difficult because people get quite alarmed when they see a seizure, and they, for obvious reasons, don't always take time to find out, what's the best way to handle it with the individual. But for people who've been going through it for years and have a comfortable regime and they know what to expect, it can be quite tedious to find somebody's called an ambulance when you know that in 10 minutes you'll be perfectly fine.
Yeah.
But none of us really are able to take that risk on somebody else's behalf unless it's somebody in your family or a friend that you know about. So, but that can be, again, and long haul flights can be tricky if you're going through different time zones and getting the medication right. And also, of course, making absolutely sure anybody who's on important medication that they've got it with them in the cabin. Too many cases of people not realising that you can't access the hold luggage during a flight, or thinking, well, it's a 3-hour flight, so I don't need to take anything with me, Then, of course, it's delayed, you're on the tarmac and all the rest of it, and suddenly it's time for your medication and you haven't got it with you.
But also awareness of getting through security if you're taking
Yeah.
liquids medication that you need like a prescription letter with that.
And knowing that you can take as much medication as you need in your hand baggage, provided you've got a note that explains what it is. And all sorts. I mean, we had a huge need for training for security staff. We've had an issue recently of people with indwelling insulin pumps and security people demanding that they be removed, which is, tremendous infection risk and completely inappropriate, but just because they don't immediately look like what they might expect. So there's a lot of work going on with hospitals dealing particularly with children and young people with indwelling pumps. And there's a kind of kidney dialysis belt for people who have sort of mobile dialysis, that if you see it, it looks exactly like a suicide vest. And again, key training for security staff is that this is, and again it's linked through to into the stomach. You cannot possibly ask somebody to remove that, but if you walk through an X-ray machine, it sets all the alarms ringing for obvious reasons. So there's a lot of training that needs to be done for security staff to understand, what different bits of equipment and medical need look like, and of course to handle people with dignity. Somebody with an artificial leg or incontinence devices, you need to be very careful how you handle them, and that isn't always the case. There have been some dreadful stories, but increasingly now, certainly in the UK and other parts of Europe, security staff are being routinely trained in disability awareness and understanding.
And you're involved with developing and establishing best practice in delivering accessibility and mobility options for people with physical, sensory, cognitive and mental health issues. And I'm interested in all those areas, but can we focus on and it might be quite a lot, but can we focus on the sensory, cognitive and mental health issues? So what type of issues are you addressing and what are the solutions out there?
Again, it comes down hugely to staff training. Frontline staff in all transport modes need to understand that somebody who might look perfectly as if they have no disability at all might be suffering from some acute mental health issue, or might not be seeing very well, or whatever it might be. So it's training people to be empathetic and to recognise people's needs is very important. And the other thing again can come down to design and to simple things. I mean, at not just Gatwick Airport now, but they developed it first of all. A lanyard that you can ask for, which just has little sunflowers over it, is a very simple, discreet way of telling staff, whether it's security or check-in staff, that you perhaps have a mental health issue, you may be on the autism spectrum, but you don't want to deal with the sort of noise and bustle and just general hullabaloo of an airport. And if you're wearing that, you can then go through a separate, quieter area that doesn't go through Dutyfree. I mean, the modern Dutyfree at airports now is designed to confuse so that you end up...
Stimulus overload, isn't it?
Absolutely.
So not for people on the autism spectrum. That's
no, or people with dementia or any kind of stress levels. There's strong perfumes, very shiny floor, which is bad if you have a low vision and very bad if you have dementia. Too much noise and a twisty route, which is meant to confuse you, so you end up buying whiskey or perfume that you didn't know you needed. But the system at Gatwick and now increasingly at other airports and transport places is that if you've got this discreet way of telling them that you can't deal with all that, you can go through a route that gets you bypassing it. So I think that kind of recognition is hugely important.
So about making the invisible visible, but in a very
discreet way. And obviously it's an individual choice. Yeah. So nobody has to do it if they don't want, and there's some people for whom even that is labelling that they reject. But many people, I know particularly parents with autistic children, are finding it hugely helpful just to get them through a busy airport or a busy station.
And there's the foresight session on disability inclusive road transport at the World Road Congress in Abu Dhabi this year. And you're currently working with DFID on a project focused on Africa and Southeast Asia. And DFID, with the Department for Transport, is developing this session. So what advice would you give to road and transport authorities in these regions to make transport more accessible?
I think that, again, the starting point has to be that all the transport professionals have the basic training to understand needs, whether they're highway engineers, mechanical engineers, architects. Even in this country, it's not compulsory to have training in access or disability issues before you qualify in one of those professions, which to my mind is disgraceful. And perhaps that's something CIHT would like to pick up. But looking more broadly across low-income countries, Africa and Southeast Asia, for example, many people with disabilities can't get out of their homes. They haven't got a wheelchair. They haven't got a long cane if they're blind. Even if they've got those things, the streets and pavements are not usable. You've got enormously deep storm drains. You've got traffic everywhere. So just rethinking design so that you're making it easier for people to travel. And it doesn't have to be hugely low cost and complex. Things, for example, at bus stops, you can build up the level of the bus stop with a ramp. So even if you haven't got low floor buses, you can enable people to board by raising the bus stop level. You can use tactile surface, colour contrast, dropping curbs at strategic points so people can cross the road. So I think the main message is, first of all, find out what is good practice, and there's lots of that about from the UK and other countries, and then start to build that in. Every time you're upgrading a road or developing a new system, just build in those good practice things and you start to make a difference. And of course, anywhere that's being funded through the World Bank or any of these huge funding programs for a new bus rapid transit or a metro system, you must insist that that's accessible from the outset. Otherwise, you've created another 50, 60 years of a system that isn't any good to people. And I'm afraid that we are still seeing that in some areas. So those sort of things combined, I think, can make an enormous difference, along with appropriate wheelchairs and so on.
Thank you. Well, I think that's certainly a good message to take to the World Road Congress, and hopefully that's one that PIARC, the World Road Association, will be able to share with its global membership. So is there anything else you think that we've not covered on? I mean, it's a vast area, but is there any aspects that you think that would be worth mentioning that you feel we've not covered today?
I think, a key message for PIARC, and it's interesting that in all its many years, it has never addressed this issue before. So it's brilliant that it's on the agenda this time. And actually, highway engineers, road engineers, politicians involved in those areas should be switching on to the enormous economic and social impact that getting it right can have. And the contrary of that, of course, is that there's a huge cost to GDP of people who are not able to be in employment, who can't get to healthcare, who can't live independently. And very often, if you track back why they can't be in employment and so on, it's because there's no accessible transport or there's no accessible streets where they live. So very fundamental things, I think. And if we can get that message through the high quality audience that PIARC will attract, I think that's massive.
Great. Well, thank you very much. That was a CIHT podcast with Ann Frye, an international specialist on mobility needs for people with disabilities and older people. Thank you, Anne.